Well, good morning everyone, and welcome back to the channel. I have decided to go ahead and make a video on my colorectal surgery. I'm going to chronicle it from a week before the surgery up until today, which is 2.5 weeks after my surgery. So making this video basically to maybe be informative to someone that may be having a colectomy. I had diverticulitis 3 times in less than 2 years, and that's what prompted the doctor to decide to be proactive and remove the faulty section of colon, which is the sigmoid colon, which is on the left side of the body. So yeah, hope you find it informative, and if not, maybe just entertaining. The main reason why I went ahead and chronicled everything is because I've never had surgery before. I'm 48 years old and I've had dental surgery. That's about it. So yeah, this was a very unique experience that I wanted to share with everyone, and if it helps anybody who may be about to go through this process, ease their mind, maybe make them a little bit more confident in electing to have the surgery. So here we go. If you're new to the channel, please subscribe and hit the notification bell so you're alerted whenever new content is uploaded. It all starts 7 days before the surgery. I have to take 2 Ensure every day to build up my strength. And 2 days before the surgery, I had to go get a COVID test. I made a YouTube video about that earlier. Now we're at the night before the surgery. I have to take 14 servings of Miralax in an hour. I mix half of it with 32 ounces of Gatorade and the other half with another 32 ounces of Gatorade, and I have to have it all drank by within an hour. This is what they call the bowel prep. This will definitely clean you out. Now for the next 5 hours, make sure you don't have any plans. Also, the day before surgery, you have to take 2 pre-surgery Ensures. They are horrible. You also have to take 12 antibiotics. Before bed the night before, you gotta wash yourself with this antimicrobial antiseptic soap. Calm down, ladies. This is all in the name of healthcare. After all that, believe me, you're ready for bed. The following morning, the only thing I'm allowed to have before surgery is 1 more pre-surgery drink. And 1 more quick wash with the antiseptic antimicrobial soap. Now it's off to the hospital. There she is, Roper St. Francis, my home for the next 2 days. We're scheduled to be there at 7:30. We got there at 7 to find out that we've got pushed back to 8:30. That stings.
Right, she told you about getting undressed.
She said you were going to do that?
Trying to get me an on time. No, I am not.
Time to take one more quick douche just to make sure everything is cleaned out. Take this opportunity just to drink it all in.
You ready for this?
Yeah. I still have my underwear on.
He didn't know.
Yeah, it has to come off. I'm sorry.
You hitting on me again?
Listen, we get straight to the point around here.
You're gonna have your hands full with this guy.
Listen, we don't take you out to dinner. We don't buy no drinks.
I didn't see any flowers.
We cut it open, we stitch it back up, and then we send your butt home.
There you go.
Here she's putting it on my leg cuffs to help prevent blood clots.
Hello. Thank you. Good morning, guys.
Good morning.
How are you?
Good.
Good. I'm Gina. You're getting ready this morning. It's a pleasure.
This is the nurse that's going to install IVs in both of my hands.
All right, my friend. Let's do your consent real quick before.
Time for your bath.
Yeah.
This nurse has a really gentle touch. I think she missed her true calling.
He's getting a spa treatment.
Wait for the cucumbers for my eyelids.
There you go. Over your oil. Now, I have to put some here off the body.
Okay.
If you could put it down, that should be fine. So that way they can call you and give you updates. You'll get hourly updates in the surgeries, and that tends to be when surgeries are longer than 2 hours.
Okay.
And then you'll get an update from the surgeon when everything's finished.
Okay.
After that, you'll get an update from the recovery nurse and anesthesia. So that's going to be a more appropriate time estimate for him getting to the floor and
Okay.
knowing where he's going to be.
Just a little off the top, please.
I'm one of the nurses that kind of works with him here at the hospital. Don't be scared. But prior to any colorectal surgery, we put some dots on your tummy. Just in the event that he would have to create a stoma or he'd wear a pouch temporarily. He's very, very good at what he does. It rarely ever happens. We just do it because it's best practice.
Yeah.
Also, fun thing that we get to do, iodine swabs in your nose. It kills any bugs that hang out in your nose.
This was really nasty and it didn't smell good at all. She gave me the option of doing it myself, but I was like, you're the nurse, you've done this before, you do it.
All right, my friend, get this done. I'm gonna have you briefly step out into the hallway while you do it. I always recommend a sit next day window that has a good view.
Okay.
Feel right.
Okay?
So what this guy is doing here is he's using ultrasound to locate nerves on either side of my body, and then he takes this really long needle and shoves it down in there and digs around for the nerve, and then while he's pushing it in there, it is very painful. Before he started this procedure, he put some medication in my IV that is for it goons you out really bad. You'll see here later on, but right now he is shoving these needles right directly into my stomach on both sides, and he says you're gonna feel pressure. I found out pressure is their code word for extreme pain.
You alright? Is that horrible?
Yeah,
What, are you drugged up now?
he gave me some druggy stuff. He said I might not even remember some of the Things going from here to there.
Really?
Yeah. That's it. Kelly.
I wanted to get you to smile.
Oh, me and my little Mitch. Real nice.
When you get surgery every
Yeah,
day.
this is really nice. It is.
Love you. Let me go. I'll call you in a couple minutes.
You alright?
Love you, bye.
Oh, fine.
I'm doing amazing.
Alright, yeah, of course you is.
He's enjoying himself.
Yeah, I'm sure he is.
Worth the price
High as
of
a kite,
admission.
yeah.
Yeah.
So, alright, so once we get started, it'll be about 2 hours or so. I'll give you a call right after, and then
Okay.
he'll be going to the 7th floor, which is the surgical floor.
Okay.
And it's just a matter of to get him up and around, walking, and hopefully start, passing gas and moving his bowels. And usually 24, 48 hours, and they're pretty much ready to go. First day is going to be the worst. It's going to be like a little bit of, incisional pain and discomfort, and we usually try to avoid any opiates because it makes them more constipated, so it causes more trouble.
Yeah.
So we'll just see how it goes. I mean, like I said, usually it's about 24, 48 hours. They usually stay in the hospital around that time, make sure that he doesn't leak or anything else. So,
Oh, that's good.
all right, and we'll send that colon to analysis to make sure there's no cancer or anything else.
Okay.
So I'll give you a call right after, and then he'll be going to the regular floor. They'll call you when he goes to the floor.
Okay.
All right.
All right. So
Thanks,
All right. I'll take care of you.
Appreciate it, brother.
See you in a second.
Alright.
yeah, he's a little.
I know, I can tell he's a little loopy. I'm Dr. Freeling. I'm one of the other anesthesiologists, okay? Nice to meet you. We'll take good care of you back there. I heard you some issues with awareness. That won't happen today, so I don't want you to worry about that, okay?
Good deal.
We'll make sure you're fast asleep, comfortable, and get rid of this horrible diverticulitis and not have to deal with it again.
That would be amazing.
Absolutely. Any questions or concerns? I walked in, he was just like, hey.
Didn't know we
Where
were.
are we?
He hasn't had a beer in 3.5 weeks.
Oh, LOL.
Didn't know we were having a party today.
See you later.
Bye, darling.
Love you, honey.
I don't know.
I can't reach. Love you. Oh, I smell that.
Yeah.
Yeah.
Alright, it's 0 hour. Getting wheeled out to go to the operating room. See you on the other side.
Okay. All right.
All right. Bye, honey.
Go. Thank you.
I'm gonna.
Emily, I'll call you in a
Wait.
little bit.
Okay. Thank you. I'll be waiting.
A robotic colectomy is a type of minimally invasive colon surgery that utilizes typically the Da Vinci robotic system to take out a segment of the colon with small incisions, with less tissue trauma, improved visualization, and improved dexterity to the instruments that are available to the surgeon. So when people hear about robotic surgery, they have these visions of an autonomous device doing the operation upon them. In actuality, the robotic Da Vinci system utilizes a console at which the surgeon sits and controls all the movements of the arms attached to the patient. A computer system translates the surgeon's movements into movements of the robot arms. This is one of the instruments that the surgeon controls sitting at the console. It's attached to one of the robot arms and placed into the abdomen. This particular instrument is a bowel grasper. It allows the surgeon to safely hold the colon, move it around the abdomen, and secure it in position to do the fine work that he needs to do. The tip of the instrument has several degrees of rotation, and the surgeon has control of that tip. It also is attached to electric cautery and allows for control of bleeding. In all minimally invasive surgery, whether it's laparoscopic or robotic, small incisions take the place of the long, typical traditional incision that oftentimes may be from the xiphoid to the pubis. The small incisions are intended to put trocars in, and trocars are the means by which instruments are inserted into the abdomen and then whatever maneuver we need to do inside the abdomen is visualized with a camera system. The number of incisions is dependent on the procedure that we're doing and the number of instruments that are needed at any one time. Typically for colon surgery, you'll have between 4 and 6 small 1 centimeter or smaller incisions. One other thing that's unique to robotic colon surgery specifically is you need to get the specimen out somehow. And oftentimes that involves a small incision that's usually only about 1 to 2 inches in length. And that's usually placed either around the belly button or down in the area where a C-section incision might be. And what's special about robotic surgery is that even compared to laparoscopic surgery, that incision is much smaller than it would be otherwise. Whenever you're removing a segment of colon, there's still plumbing that needs to be taken care of. So you have 2 ends of the tube of the colon that somehow need to be put back together again. In general terms, there are 4 steps to the process. First, you're going to remove the segment of colon, resect it. Then you're going to have to take it out somehow. We've talked about that through one of the small incisions. You're going to need to put it back together again. That's the reconnection of the plumbing. And the seal and suture, that's kind of combined together in the stapler technology that we use. So the staplers seal and do the function of hand-sewn suturing. We also have the option of utilizing the robot and its dexterity to suture together the ends of bowel as needed.
How you feeling?
I got run over.
Oh, honey.
Now I'm in recovery and have been told that all was successful. Now I'm a little bit more with it and am finally in my room. It took a while to get in the room, but it was worth it. It's a nice private room with a great view. You'll see that in a little bit. It's 3:25 in the morning on, the fuck would this be, Wednesday the 3rd. And I got woken up to some rumbling, so they come in and confirmed that my bowels are waking up. And I asked them, should I try and expel flatulence or worry about a accident? They told me to go ahead and expel the flatulence, but now since they've said that, I don't feel the need to, so I'm worried about it. So I don't want to make an accident in the bed. So I'll keep you updated. Well, it's about 6:30 Wednesday morning the 3rd. And they just got finished removing my catheter. Yeah, they said, oh, it ain't that bad. Oh, it burnt really bad. But now they got me out of the bed. I'm sitting up in a chair. Already went to the restroom by myself. And let's say I'm well on my way. Check back with you in a little bit. Now I'm about to go for a walk. I did go for a walk the first day after the surgery, probably about 2 or 3 hours after I got in the room. It was pretty rough, but this is the next morning. It's a little easier to walk. What I didn't tell you a little bit ago was I did try to pass gas that night between 3:30 and 6 o'clock, and I did it numerous times. But when I got up to walk this morning, yeah, it wasn't flatulence. I had a really bad accident, and I mean really bad. I'm not going to get graphic, but to make a long story short, I really feel bad for the 2 nurses that had to tend to the bed and myself. It was rough. It's a great view of the James Island Connector out the end of the hallway. Every time I made a lap, I made a point to stop and look out. Well, hello there. These are my 6 incisions. That tube is a drain tube, and it felt really horrible when they pulled it out. And here's a little time lapse of my midge trying to come visit me, and she got lost, and it took her forever, but she finally found me.
What's your relationship?
Damn COVID.
My husband.
I only have one visitor at a time, and only a total of 2 visitors a day.
Been around anybody?
It sucked.
Nope.
Fever, chills, shortness of breath,
Nope.
fever or chills?
No. There's my own bear.
Don't wanna touch you, don't wanna see. You got a knife in your heart, but don't say that you did it for me.
Very nice.
Unchain the night.
Thursday, the 4th, I guess it is. You dressed up. 5E's out. Green's out, about to go home. Just waiting on the wife.
Headed to go get our daddy.
We on our way out of here. Yeah.
Well, I hope it's a wonderful experience.
Yeah, it was good for what it was.
You had
Let's
the
put it
nice
that way.
waterfront property.
Yes, it was very nice.
Yeah.
I did many a laps on this floor. Alright, there's your wife right there. Heading home with the ladies. My chauffeur. Beautiful back. Alright, until we get home. The hospital was a good hospital. The staff was very, very good. I mean, they were very nice, very helpful. This view was just amazing. I looked at it a lot. Now, when I get home, I don't take a whole lot of videos of my recovery, but I do show you some aspects of what it took to recover. This is a slew of medication I have to take, including injections to the stomach. Traditionally, I've never been really good with needles, and it really was spooky to have to inject myself once a day for 7 days, but it really wasn't that bad. It really didn't hurt when you injected it, but when the medicine went in there, it burned for like 5 or 10 minutes, but all in all, it wasn't bad. I was instructed to get a used laundry soap bin and write Sharp's biohazard all over it to put the syringes in. And that way it would alert sanitation workers as to what is in there and to be careful. Once they were all in there, we duct taped the top on it. I had the wife make some biohazard stickers and I placed them all over this thing. That way there'd be no question. Those of you that have had surgery before already know what this thing is right here. But for those of you that have not had surgery before, let me explain what it is and exactly what it does. This is called an incentive spirometer. It is for you to blow out into it and hold your breath to open up the sacs inside your lungs and keep fluid from building up in there and causing you to have pneumonia. It was very difficult keeping track of all these medications and when you have to take them. Well, it's been a week since my surgery, and my incisions are doing a lot better. I'm able to shower like normal, and I'm walking more and taking less pain medication, so I would say things are coming along quite nicely. Also, I was able to sleep on my side for the first time last night, which I've been having to sleep on my back with my head elevated since this started, so I think maybe tonight I might try sleeping on my gut. They didn't tell me how long I had to sleep with my back elevated, but I'll let you know. I've lost 10 pounds since I started doing this video, so I guess that's a positive. Checking with you probably at my first follow-up visit with the doctor on the 17th. Today is the 10th. And we'll see you then. Well, today it's been a week since I had my surgery, and they encourage you to walk. I've been walking around inside the house for a little bit the past week, and today's the first day I'm without pain medication aside from Tylenol. So I figured it's a good time to come out and take a walk. So here I am. Well, I went down to the end of the street back there, and no problem. It actually feels good being outside. It's a beautiful day out today, as you can see. So yeah, I think I'll try and extend my walk tomorrow to maybe 2 times down to the stop sign and back, and before you know it, I'll be going around the block. Alright, that's it for now. What is all this for? Saw this on the counter in my waiting room. It's an anoscope. They shove it in your posterior to look up in there, and I was trying to figure out how I was going to break it to him that I was definitely not going to go for this today, but luckily this wasn't for me anyway. So, dodged a bullet there. Well, today is 2 weeks and a day since I had my surgery, and I just got back from my follow-up appointment with the doctor. They said all is going well. My scars are healing well. I'm right on schedule from where they want me to be at this point right now. It is Wednesday the 17th of November, and I'm cleared to go back to work on Monday the 22nd at light duty, meaning that I'm not allowed to lift anything over 10 pounds, can't bend over to lift anything up, but I've talked with my work, and they look like they're going to make a pretty good effort at working around that for me so that I can get back to work. As of right now, I'm pretty optimistic, happy with the way things are going, and I was even cleared by my doctor to drink a beer tonight, which I haven't had any alcohol whatsoever in about 5.5 weeks. And for a guy that drinks every night, it's been murder, so it's going to be a great night. I'm not going to go balls to the wall and drink like I was before. Like I said, I'm going to start off slow, drink 1 beer, see how it goes, and go from there. As you can see here, walking's going great. I'm making laps around the block and everything. It's pretty sweet. Yep, that's been a positive of this whole experience, getting to walk around my neighborhood and enjoy its beauty. Well, there you have it. I know the video was a little bit on the long side. I apologize for that, but it was a lot of information to put in there. If you stuck through it till the end, I appreciate it, and hope you enjoyed the video. I'm doing great. My incisions are healing very well. Doctors expect nothing but a full recovery. Thank you very much for watching the video. I hope you enjoyed it, and do me a favor and hit the like button, because it really helps the channel. The more likes you get, the more apt they are to put your video on search lists for people and get it a little bit more out there. So, and like I said before, if you haven't subscribed, please subscribe, and thank you very much, and we'll see you next time. Have a good evening.